Hello everyone, I am Dr. Umma Karadan. I am a Chief of Neurological Services at Baby Memorial Hospital, Calicut. Today, I would like to speak on a particular condition called trigeminal neuralgia. It is one of the most painful conditions for humanity. It is such a painful condition that it causes severe depression and even suicide because it has been reported since time immemorial. So this is a particular pain that occurs in the distribution of a nerve called trigeminal. Tri means three, geminal means root. So there are the one nerve called trigeminal nerve has got three roots. It involves the ophthalmic, the maxillary, as well as the mandibular branch. The cause is largely unknown, but of course there are certain conditions called where the one artery can get kinked around the nerve, something, so one artery called superior cerebellar artery or the vertebro-basilar artery. This can give rise to some sort of aberrant changes, excitation of the nerve, which causes electric shock like severe lancinating short lasting pain involving either this area or this area. Usually it affects this maxillary and mandibular nerve branches. It exactly stops short of the midline. It wouldn't cross to the opposite side, right? So the pain lasts for seconds to minutes. Very rarely this can continue for more time, but usually it occurs for seconds to minutes. This is triggered by some triggers, like if you touch the face, or if you speak, or if you brush your teeth, or if you swallow something. This gives rise to severe pain, and that is intolerable pain. That is the reason people come to medical attention, and they are frustrated because if the drugs are not effective, because they can go out to the public and speak or talk or eat food with their relatives, because their main concern will be how to circumvent. Suppose the pain comes, what should I do? Because they'll be in panic, they'll be anxious and apprehensive and gets depressed sooner or later. Okay, so this occurs maybe 4 to 5 per lakhs, usually females, but of course males are affected. Any age is okay, because it can occur in young people as well. Especially if it occurs in the young, you should be careful, because there is one condition called multiple sclerosis that affects the brain and the spinal cord. When there is this nerve enters into one part of the brain called the pons, if there is some lesion, some demyelination, this can give rise to pain. Alright. Similarly, when the nerve enters just before entering into the brainstem, this can get blocked, or there may be some infiltration around the nerves, or some tumors in the nerve, or tumors around the nerve, or tumors arise from the meninges, from the arteries or veins, which can engulf the nerve, which cause severe pain. This is called a secondary cause of the trigeminal neuralgia. So usually almost maybe 99% is no cause can be found, but maybe there is this artery may be engulfing around or compressing the nerve at the entry point of the nerve into the pons. Alright. So the clinical symptoms are unilateral, so that will be one-sided severe lancinating electric shock like pain lasting for seconds to minutes, and it is worsened by any maneuvers like touching or with a cold breeze or eating, brushing or anything. Alright. So the how do you treat? The treatment is usually by medical, by giving certain drugs called oxcarbazepine or carbazepine, or rarely other medicines like pregabalin, gabapentin, and many drugs are available. So before that, we should know that is it a true trigeminal neuralgia or is a atypical neuralgias. The atypical neuralgia means there are so many things in and around the face. You should be knowing that. You have the teeth here, you have the sinuses, you have the nose, you have the eyes, you have the joints here, you have a gland called the parotid gland, the ears, the neck and the arteries, veins and various nerves. So any involvement of any of these structures can give rise to pain simulating trigeminal neuralgia. But there will be a certain characteristic difference will be there for every one of these. I will come to that in a moment. Alright. So if you experience this pain, you have to consult your doctor and take his opinion whether it's a primary or it's a secondary, whether you can treat with it medically, or if the person is not able to tolerate the pain, or if there are intolerance to any of this medication, then we can go to the next options. As I told you, the problem, the pain usually occurs in this, either in this distribution here or on two nerve roots. The pain can be simulated by condition in and around the eyes, like some cellulitis, some glaucoma, or any tumors behind the eyes, or it may be due to the sinuses, the maxillary sinus, ethmoid sinus, or sphenoid sinus, or it may be due to the problem with the bone or the teeth, due to a dry teeth, or a dry socket, or caries or rupture of the teeth. Sometimes it may be due to a problem in the joints called temporomandibular joint, where you get some sound will be there when you open the mouth, and when you press here it will be painful. Usually occurs along with some arthritis, like rheumatoid arthritis, or some trauma, or some dental malocclusion, something. Then there is one gland here called the parotid gland. The gland may be inflamed, that means some infection there, or the gland, there may be a tumor in the gland, like a parotid gland tumor, or either benign or malignant. Sometimes there can be stone in the gland, like sialadenitis or stones. Okay, so also any problem in the ears, in the mastoid region, that is behind the ear. And there are so many nerves here, like auriculotemporal nerve, great auricular nerve, supraorbital nerve, infraorbital nerve, mental nerve, and you have the lesser occipital nerve. So any of this nerve may be affected due to some condition, maybe a infection, inflammation, viral, something which can also give us to severe pain on one half of the face. Similarly, there are certain nerves which supplies the tongue, like the glossopharyngeal nerve, or the nervous intermediates that goes along the facial nerve into a canal. And even in case of herpes zoster involving the seventh nerve, this can give us to painful, there will be, of course, there will be some rashes, or a vesicle will be there in the pinna as well as in the face. It is called Ramsay-Hunt syndrome. So there are so many conditions, and sometimes the nerve can be affected due to some infection or inflammation, or autoimmunity, or some cancer-like condition which would affect the nerve. It's called a trigeminal neuropathy. Okay. Similarly, there is one artery here called the carotid artery. The artery can get inflamed due to carotidynia, or the artery can rupture due to like a trauma, or some boxing, or sudden twisting or turning, or undue stressful exercise. That also gives rise to pain here. Even the heart pain, the cardiac pain sometimes can relate to the both jaws and the face as well as the skull. So especially when they move about, when they climb still upstairs, or walking fast. All right. Similarly, there is one artery called the temporal artery that gets inflamed in certain people after the age of 50 or 60 with high ESR, and they respond very well to steroids, and they usually come with the pain in the face, especially after chewing something, and if you touch here it will be painful. Certain migraine, like a SUNCT, that's been short lasting severe neuralgiform headache with the conjunctival tearing and injection. That means watering, redness, and severe short lasting migraine can also present like severe pain. Some migraine can also present like that. So basically you have to differentiate whether it's a trigeminal neuralgia and whether it's a condition due to other causes which I have just mentioned. And how do you treat? The treatment is you find out the cause, whether it's a primary or a secondary cause, and you should buy medication like as I mentioned earlier, carbazepine, oxcarbazepine, and other second line medication. Once this fails, or if the person is not able to take this medicine no longer, in that case we can go for the secondary option. Those are the microvascular decompression. That's you do a surgery, a neurosurgical procedure, where they put some sponge between the artery and the nerve. Okay, that's as simple as that. They don't remove anything inside. They just keep something in between, the soft sponge-like thing in between the artery and the nerve. Alternatively, if we can do certain other condition, we can block the arteries. Block the nerves, the supraorbital nerve, the infraorbital nerve, mental nerve by nerve blocks. But the problem is that this lasts only for 1 to 2 weeks. We can also give injection to that nerve, area called the alcohol injection or glycerol injection or thermocoagulation or balloon compression of that nerve. In that case, it can have a long lasting effect, maybe 4 years. We can also do a radio frequency ablation, where you give certain temperature to that nerve entry zone into the the one ganglion called Gazerian ganglion. That is you go through go under the fluoroscopic guidance. All right. So this is, of course, the effect will be much better compared to this, compared to the other thing. So we can have a radio frequency ablation, you can have balloon compression, you can have alcohol injection, glycerol injection, microvascular decompression, all the medication. And we can also give botulinum toxin injection to that particular nerve, because usually it will be somewhere here or here. This is the most common trigger points, or it can be anywhere. It may be here, it may be here, it can be anywhere. You can give 20 to 25 units of botulinum toxin injection, is also having a good relief maybe, but the problem is that this lasts maybe 2 to 6 months, and you may have to add the other usual medication, but if they are better, you can always try to cut down the medication. So this is in short regarding trigeminal neuralgia and the secondary cause of the trigeminal neuralgia, because it is very important, because many people suffers, and there are many people like William Gladstone of UK. He was a minister for 4 times. He had this condition, and of course our Hindi actor Salman Khan also had been operated, I think, for trigeminal neuralgia. So this is the matter I would like to share with you, and I hope you understood what is trigeminal neuralgia and the secondary cause of the trigeminal neuralgia. And if you have any queries or concern or doubt, you can mail me. It's already given here. Thank you very much. Bye.